Hi friends, it's Dr. Ladda again, and today the topic of discussion is intramuscular spaces in the scapular region. We know the scapular region, a region near the shoulder joint, and in that region, if I am removing the posterior part of the deltoid muscle, I can view these three spaces in that region. One space is quadrangular in shape, and second remaining two spaces are triangular in shape. One is at the upper part and second is the lower part of the of this region. Now, for getting it more simplified, it is wise for we to consider the situation of three muscles. One is teres minor, second one is teres major, and third one is your long head of tricep muscle. If you are looking carefully, that a space between teres minor, teres major, and the long head, there are two spaces between these two, and one is quadrangular space and second one is upper triangular space. And now again at the lower part, if you are looking, there is a space between teres major and your tricep. No doubt your bone humerus is playing role there. Now before proceeding this, it is wise to know the direction of the muscles so that it can become simple to find and to study the your spaces of the scapular region. If you are looking carefully there, you can find there are two muscles which are running in a horizontal direction. At the upper part there is teres minor and at the lower part there is teres major. And means these two muscles are taking origin from the scapular region and they are going to the humerus, a bone of arm. The first, your teres minor, it is going towards the greater tubercle of the humerus. The second, both are taking origin from the scapula. The second, that is teres major, and if you are looking the figure carefully, it is going towards the shaft of humerus, and we know lady between two majors. So it is inserted on the medial lip of your bicipital groove. In the same sense, if you are looking the third muscle, that is the tricep, long head of tricep. We know the tricep has three heads: long head, medial head, and lateral head. These medial and lateral heads, they are taking origin from the humerus, whereas the long head, it is taking origin from inferior glenoid tuberosity, as the superior glenoid tuberosity give origin to the bicep. Bicep from the superior tuberosity of the scapula and tricep from the inferior glenoid tuberosity of the scapula. So this head of the tricep, it is going down, it is vertical, it is going down, and we know it is inserted on the posterior part of olecranon process of the ulna. Now we are having the knowledge of all three muscles, teres minor, teres major, and your long head of tricep. And now you can look, there is one bone, that is the bone of arm, humerus, and all these four things, they are playing a role there, and these things are forming the spaces, and even these things are working to be a border of the spaces. Now proceed with one by one. If I am considering the first space, that is quadrangular space, look carefully. The quadrangular space is superiorly bounded by a muscle. The name of muscle is teres minor. It is inferiorly bounded by the sister of teres minor, and that the name of that muscle is teres major. It is medially bonded by the long head of tricep, whereas it is laterally bonded by a bone, a part of that bone. Which bone? Humerus. The part of that bone is surgical neck of the humerus. It becomes easy if you are remembering those muscles and you are drawing just a simple figure. And so it is. Now the next upper triangular space, if you are looking again the figure carefully, you are getting that the upper triangular space is little different compared to the lower triangular space. Upper triangular space, see the apex of that triangular space is going toward the scapula, and the apex of lower triangular space is going towards the elbow. Now this upper triangular space, due to its specific shape, it has superior, inferior and superior, inferior and the, look carefully there, it is superior, inferior and lateral borders. Whereas if you are looking carefully the lower triangular space, it is different than upper triangular space. So lower triangular space has superior border, medial border and lateral border. Now proceed with the upper triangular space. This upper triangular space having superior border, which is formed by teres minor muscle. Its lateral border is formed by long head of tricep muscle, and the inferior border is formed by teres major. First is teres minor, superior, lateral, long head of tricep and inferior teres major muscle. In the same sense, if you are thinking about the lower triangular space, you are getting that lower triangular space has superior, medial and lateral borders. The superior border is formed by teres major again. Medial border of the lower triangular space is formed by long head of tricep, and the lateral border is formed by bone, a part of that bone, that is the shaft of humerus. So these are the borders of triangular spaces. Now the contents. These triangular spaces contains two nerves, all these three. These three triangular spaces contains two nerves. One is axillary nerve and one is your radial nerve. And again these spaces contains veins and arteries, or you can say arteries and veins. So the quadrangular space, it contained a nerve, that is axillary nerve, and two vessels. Among these two, one is artery, and the name of artery is posterior circumflex humeral artery. And in the same sense, if there is artery, definitely there is vein. So the vein of the triangular space is posterior circumflex humeral vein. Now this is about the quadrangular. Now the upper triangular space. Your upper triangular space contain circumflex scapular artery, or you can say the circumflex scapular artery passes through the upper triangular space, and your lower triangular space contain one nerve, that is radial nerve, one artery, that is profunda brachii artery, and one vein, but natural, profunda brachii vein. This is all about the spaces, you can say intramuscular spaces in the scapular region, and I think so you are getting that. Just reading the figure, understanding the figure is sufficient to put the total answer of your spaces. Thanks for watching the video, and hope so you are perfectly clear with the concept of your spaces in the scapular region, and I will proceed further in the next video with 2 or 3 5 marks questions.